Hi, I'm Dr. Utkarsh. The common cause of toothache is tooth related or gum related. In the tooth related causes, it can be a cracked tooth, or most commonly, it can be a dental caries, which you commonly call it as a cavity, or a broken tooth. And this in turn can lead to a gum disease, where we call it as a periodontal disease, where a lot of harboring of bacteria can happen inside your gums, which can be hereditary, or it can also be because of lack of oral hygiene. A tooth abscess is nothing but a pocket which is filled with pus. So why is a tooth abscess caused? It can be because of the caries on a tooth, which the bacteria will percolate through the tooth root into the bone, or it can be localized into the gums. So these are two main causes of the bacterial abscess or the pus. So secondly, what are the symptoms? How do you identify that there is an abscess? There can be excruciating pain. There can be a pus discharge from your oral cavity, pus discharge from your gums, or there can be numbness of your lip or your tongue or both, and the swelling on the face can be very evident. These things can happen in very acute conditions where you need an emergency treatment. So the swelling, as I already told you, or an abscess can happen because of tooth or a gum, and this gets into the bone or onto the gums. And there are some spaces in the oral cavity and the neck and the face which are called as facial spaces. These facial spaces are very permeable, or the boundaries are not very well defined. So the abscess, if it is left untreated, can go into any of these spaces. There are more than around 7 or 8 potentially hazardous spaces. One can be on the cheek, under the chin, near your eyes, around your nose, and in various other planes on the one side or both the sides. When it can be an emergency, it can be an emergency when the abscess will seep into the sublingual spaces or submandibular spaces, what we call. That is under the tongue basically. So when the abscess grows, the tongue will raise up like this. And once the tongue raises up, it blocks the air passage into your lungs, and this can be a potential emergency and a hazard. This condition is called as Ludwig's angina, and this has to be treated in the emergency ward or an operation theatre on an emergency basis. And the best way to stop all these things is to get your teeth checked with your dentist on a regular basis, could be around 6 months once, get periodic x-rays, and avoid all these issues. First of all, you should do an examination thoroughly. Secondly, we should see why the tooth abscess has happened and treat the tooth. If it is a wisdom tooth, we may have to remove it. If it is a caries tooth which involves the pulse, then you should do the root canal, or at least do the emergency access opening so that the pus will get out of the tooth root. Secondly, you can also do an incision and drainage, where we do a small nick on the abscess in the most dependent area, avoiding the very important anatomical structures, and drain the pus out. And put the patient on empirical antibiotic therapy along with some anti-analgesics, and also you can give some enzymes to reduce the swelling. Yes, a toothache can cause a swelling in the lymph nodes if the tooth gets infected. It always drains into the submandibular or a sublingual gland. Sometimes it can drain into the parotid nodes as well. You should see a dentist as soon as your teeth starts hurting. Not only hurting, even little sensitivity. Please don't neglect, go to your dentist, get it examined thoroughly. If required, take an x-ray and do the necessary treatment. If at all it leads into abscess, there is no way you can wait. Immediately you should go and visit your dentist. But prevention is always better than cure. So definitely I insist that you get a periodic dental checkup every 6 months with or without dental radiographs. There is actually no home remedy for toothache at all. Only the symptoms of a toothache can be reduced by gargle your mouth with salt water. That's all.